Hello, and thank you so much for joining us today. I'm Dr. Masha Livhits.
And I'm Dr. Yasmine Assadipour.
We're endocrine surgeons here at UCLA, and today we'll be discussing what we know about why people get thyroid cancer. So please ask any questions you have on Twitter using the hashtag UCLAMDChat. As an overview, we'll start by discussing what we know, and we'll also be very upfront about what we don't know about reasons for thyroid cancer. We'll talk about personal and lifestyle risk factors for thyroid cancer. We'll also talk about some of the genetic mutations and genetic syndromes that are associated with thyroid cancer. We'll talk about environmental risk factors and specifically radiation exposure. And then we'll end with why thyroid cancer is becoming increasingly common both in the United States and all over the world, and how worried we really need to be about this. So let's start with kind of overall, what do we know about the causes of thyroid cancer? As an example, lung cancer is one of the most common types of malignancies and can be quite aggressive and cause cancer mortality. However, at least we know one of the major reasons why people get lung cancer, and we know that's really tobacco smoking. And cigarette smoking is the major cause in 80 to 90% of lung cancer cases. So it's not all of them, but it is the vast majority. And we know that people who smoke are 15 to 30 times more likely to get lung cancer as opposed to non-smokers. So in thyroid cancer, there are some specific risk factors that increase the chance that an individual will get thyroid cancer. But in most cases, a person will not have any identifiable risk factors and may still develop thyroid cancer. So for thyroid cancer, there's not really sort of one major risk factor that's been identified like there has been for lung cancer. But please keep listening and watching, but because we do have a lot of kind of useful information about the risk factors that we do know about that are associated with thyroid cancer. So let's start with the personal and lifestyle risk factors.
So the biggest risk factor for thyroid cancer in terms of something that's personal and something that's not modifiable, meaning there's nothing you can do about it, is that being a woman puts you at risk for thyroid cancer at a rate of about 3 times the rate of thyroid cancer for men. And the incidence also increases with age, peaking in the 4th or 5th decade of life. In terms of modifiable risk factors, a lot of people ask about alcohol and smoking and diet because these are things that have been linked to other types of cancers. And the case is that with thyroid cancer, alcohol use and smoking don't actually increase your risk of thyroid cancer specifically, although we still counsel people to drink in moderation and avoid smoking altogether because of the other cancers and health risk factors that these come along with. And in terms of diet itself, there's no specific diet that will increase or decrease your risk of getting thyroid cancer. Iodine deficiency, particularly when you were growing up, can cause you to have what is known as a goiter, which is an enlarged and nodular thyroid gland, although these are typically benign and not cancerous. In the past, there were many areas of the world where iodine deficiency was fairly common, particularly Eastern Europe, the Middle East, and Africa. Through the last few decades, most countries have moved towards using iodized salt, and this is creating an improvement in that iodine deficiency such that most people in countries, particularly in the United States, for example, and Western Europe, are now having an iodine replete diet due to that iodized salt. Most of the table salt you use at home is iodized. Most of the bread products or cookies and crackers you get in a grocery store will also be iodized. And that is helping to make sure that people are iodine replete.
So do you think there's a certain amount, or do people who live in the United States need to worry about quantifying how much iodine they're consuming?
That's a great question. So in general, if you're living in the United States and you're not following a very unique diet, you should be getting a perfectly good amount of iodine in your diet. And iodine supplementation does not help at any point in decreasing your risk of thyroid cancer or decreasing the size or working to change the function of your thyroid gland. So as long as you're eating a fairly balanced diet in the United States, you should be in good shape in terms of your iodine status.
And what kind of diet do you think might put you at risk for iodine deficiency?
If you're really following a very strict diet of absolutely no processed foods of any kind, such as a raw vegan diet, and you are also only using something like sea salt, which is not iodized, as opposed to standard table salt, you might then be putting yourself in a position where you may not be getting enough iodine. The biggest modifiable risk factor that has been linked to thyroid cancer is obesity. And obesity has actually been shown to increase the risk of many cancers, most importantly breast cancer, colon cancer, ovarian cancer, and thyroid cancer. And it's not totally understood why, but a lot of the work being done and a lot of the theories around the fact that excess fat, especially around your vital organs, causes chronic inflammation and hormone imbalances, and that these cause the cells in your body to divide and reproduce more. And every time you divide and reproduce your cells, you're introducing the chance for an error to happen with your DNA replication, and that's when mutations happen, and that gives cancerous cells a chance to develop. So we measure obesity by the body mass index, which is the formula that takes into account your height and your weight. And for point of reference, if you're about 5'4", 175 pounds or more would put you in the category of obesity. And thyroid cancer has been shown to increase with your body mass index, particularly over a BMI of 30. So it's important to understand that all cancer cells have mutations, and these mutations can either be inherited from your parents' genes or they can arise from your own cells during cell division. And most thyroid cancers have mutations that are actually not inherited. So in terms of the genetics of thyroid cancer that are not necessarily inherited, the most common mutation that's found in about 30 to 40% of thyroid cancers is a mutation in the BRAF gene. This can also put you at risk for a thyroid cancer that is more aggressive than thyroid cancers that do not have this mutation. And again, this is not an inherited mutation. Another common mutation is the RET PTC oncogene, and that can impact about 10 to 30% of papillary thyroid cancers. It can also, in a genetic setting, in an inherited setting, cause different kinds of thyroid cancer as well. So the RET mutation can either be inherited or not inherited. It's more frequent in cases of childhood cancer and in cases of radiation exposure.
This is a very exciting field in thyroid nodules and thyroid cancer. So even though we may not know exactly why this genetic mutation may occur in a person, there isn't necessarily anything we can do to prevent it. It really does help us to understand an individual person's cancer. So more and more we can know what the driver mutation is in an individual cancer, and that may help us to have an idea of the prognosis, how aggressive that cancer might be, what the treatment may be that's necessary. So this isn't totally ready for prime time yet, but I think increasingly in our algorithms of how we treat people with thyroid cancer, understanding these mutations is going to really help us to kind of personalize the treatment for an individual person in cancer.
Absolutely. There is targeted therapy that exists to treat patients with this BRAF mutation in both thyroid cancer and melanoma. So it can be very helpful to know the genetics of your thyroid cancer. In terms of inherited thyroid cancer, about 5 to 10% of thyroid cancers are due to an inherited mutation as far as we know right now. And there are a lot of candidate genes for what we'll call familial thyroid cancer. There are also rare cancer syndromes that involve multiple types of cancer that include thyroid cancer but also include other types of cancer within the syndrome. So one example of a familial thyroid cancer gene that was actually recently discovered in 2015 is HAPI2, which is a protein that's found in our blood. And this team of researchers at the NIH found that in a family with familial thyroid cancer, meaning multiple people within this family, if you look at this chart here, you can see that everybody with a gray is someone who had thyroid cancer, all had the same mutation. And then when they also looked at the cancer cells of other patients with thyroid cancer, they found about 5% of those people had this mutation as well. So this is just one example of how we're always learning and discovering more genetic causes for thyroid cancer, and maybe in the future there will be even more thyroid cancers that can be related to mutations that we just don't know about yet. In terms of genetic syndromes, the most common syndromes we hear about are familial adenomatous polyposis, which is a mutation in the APC gene. This puts you at risk for, most importantly, colon and GI tract cancers, but it also puts you at increased risk for thyroid cancer. There's also the PTEN hamartoma gene complex, and mutations in the PTEN gene can cause hamartomas, thyroid cancer, and breast cancer. And a very well-known endocrine neoplasia syndrome, MEN, with mutations in the RET gene can cause medullary thyroid cancer, which is a very specific type of thyroid cancer that's fairly rare, as well as pheochromocytomas, which are tumors of the adrenal gland that secrete the adrenaline hormones. So it's important to know when people have this kind of family history of many relatives with these kinds of cancers so that we can better treat them and have their children undergo screening.
Yeah, I think that's a really important point. Oftentimes, somebody, particularly with the MEN syndrome, there will be people in the family that already had medullary thyroid cancer or this adrenaline-producing adrenal tumor, the pheochromocytoma. And if that can be identified earlier on, and that can be done with genetic testing, then we can often even remove the thyroid before the medullary thyroid cancer has a chance to develop. So we can treat those patients preventatively, and it's usually with surgery before they even have a chance to develop cancer. So that genetic screening becomes very important for those families.
There are also environmental risk factors that are associated with thyroid cancer, and one that was recently kind of discovered is that there are some types of flame retardants that were used to provide building insulation, foam within furniture, and lining for curtains and drapery that when they examined the dust of people's homes, higher levels of these flame retardants were actually associated with higher rates of thyroid cancer. And so that was a really interesting finding that was pretty recent. And the good news is that these compounds were already being phased out of industrial use before this discovery. And hopefully with learning more about these flame retardants and how they can negatively impact people, they will continue to try to replace them with more environmentally safe compounds.
So the other kind of major risk factor for thyroid cancer is radiation exposure. The thyroid is particularly susceptible to DNA damage and changes related to radiation. So radiation, we know, increases the risk of both benign thyroid nodules, malignant thyroid cancers, and also hypothyroidism, which is when the thyroid just doesn't produce enough hormone. And the risk is really dependent on the dose of the radiation and how old you are at exposure. So people always are worried about, well, what about dental x-rays, or what about screening at the airports? So while we don't know what the kind of lower threshold is, this is a very low amount of radiation exposure that we think is probably very unlikely to cause a thyroid cancer. So what we're really worried about is childhood radiation exposure, particularly high dose radiation during childhood. So before the 1960s, children were treated with low-dose radiation for a variety of treatments that we would no longer use radiation for, including acne, a fungal infection of the scalp, and enlarged tonsils. And there's some evidence that even this kind of low-dose radiation slightly increases the risk of thyroid cancer because it was children that were exposed to it. X-rays people also worry about. For example, if a child is brought to the emergency room and has to have a CT scan because we're worried about appendicitis, that has a low amount of radiation exposure. So probably, something like one CT scan or X-ray, that overall has a pretty low amount of radiation, does not increase the risk significantly. But perhaps multiple scans in childhood, that's where we may start to get worried. And this is where really the highest risk is, high dose exposure during childhood. So this would be radiation treatment for another malignancy, specifically leukemia, lymphoma, bone cancer, sarcoma. There's a Wilms tumor of the kidney. These are cancers where radiation is an important part of the treatment modality. It can't be avoided because it's really important to treat the primary malignancy, but it definitely increases the risk downstream of the child developing thyroid cancer. So there's a very large study called the Childhood Cancer Survivor Study. So there were over 1,200 survivors of a childhood cancer. So these were children that were followed for multiple decades. 8,000 of them were treated with radiation. And the increased risk of thyroid cancer was up to 15-fold. So a child was 15 times more likely to develop thyroid cancer if they were exposed to radiation during childhood. And you can see it's dependent on how old they were. So that top line, solid line, is children less than 5 years of age. So the younger you were when you were exposed to radiation, the more likely that you're at risk for thyroid cancer. However, I want to point out that the total number of thyroid cancer cases was only 119. So even though a 15-fold increase sounds like a lot, and it is, it's still a relatively low number of patients who end up getting thyroid cancer. So then the other major source of radiation is environmental radiation, specifically survivors of atomic bombing or people who live near the site of a nuclear accident. So the kind of two very well-known incidents were Chernobyl in 1986, Fukushima in Japan in 2011. And this exposed people to radiation primarily from iodine isotopes, and it increased the risk of thyroid cancer by about fivefold. And it's really dependent on your proximity to the area of the nuclear accident, how old you were when you were exposed. So again, the younger you were, the more of a risk factor, and the iodine status. As Dr. Assadipour mentioned, this was actually sort of a time when there were some people, for example, in Eastern Europe, that were iodine deficient. So if you were iodine deficient and exposed to radiation from a nuclear accident, you were a little bit more likely to develop thyroid cancer. So the governments actually at that time did hand out the potassium iodide drops, and there is evidence that that decreases thyroid cancer developing if you are iodine deficient and in an area of a nuclear explosion. Some more data from the Chernobyl nuclear power plant accident. You can see the accident occurred in 1986, and there's a delay about 10 to 15 years from the accident to when thyroid cancer would develop as a result of the radiation exposure. And then this red is the children. Okay. The risk of thyroid cancer from this exposure really lasts for many, many years. So we'll end up with, why is thyroid cancer becoming increasingly common really all over the world, and how concerned do we need to be?
Yeah, so the incidence of thyroid cancer has been increasing consistently over the last 20 years and is projected to continue to increase. I think a lot of that is actually related to what's called discovery bias or detection bias, in that we're looking for these thyroid nodules a lot more than we used to. Nowadays, a lot of patients, when they see their primary care physician for a sore throat, difficulty swallowing, some nonspecific neck pain, will undergo a neck ultrasound or a thyroid ultrasound, and then this is how we sometimes discover these nodules that were unrelated to the patient's symptoms, but now we know about them, and sometimes they can be thyroid cancer, although most thyroid nodules are actually benign.
And if you look at this, incidence, this is the total number of thyroid cancer cases that are increasing. The good news is that most of them are what's called papillary thyroid cancer, which is the most common type of thyroid cancer and also the least aggressive.
Right. So the more aggressive thyroid cancers, medullary thyroid cancer and anaplastic thyroid cancer, have not really significantly been increasing in their incidence, and that is very good news.
Yeah, those are those flat lines down here.
Yeah. So in addition to what we're calling detection bias, there is actually a true increase in the incidence of thyroid cancer, and it's not totally clear why right now, although it may be things that we're learning about now, like the recent discovery about flame retardants, something else in the environment.
Radiation exposure.
Radiation exposure, the increased prevalence of being overweight and obese in essentially all of Western society right now. So probably all of those things are playing a role together.
So I think, as we pointed out, the number of new cases of thyroid cancer has increased, and we do think a lot of it is due to the increased discovery. There's actually been what's called an epidemic of thyroid cancer that's been reported in multiple journals, and it was initially first reported in some Asian countries where they instituted whole body screening ultrasound programs. So people without a specific lump that they felt that would get ultrasound. So that's why we point out, we think a lot of these cases are just due to increased discovery, but that even when you account for that, there truly are more thyroid cancers that are developing.
Yes, I think in Korea and Japan, surveillance programs are becoming more and more popular, and this can involve either a whole body ultrasound or even sometimes a whole body PET scan, and that can find a lot of incidental things that may or may not be playing a role in the patient's health long term. So overall, the good news is that survival for papillary thyroid cancer, which is the most common form of thyroid cancer, is well over 90%. Surgery is the mainstay of treatment for thyroid cancer, so there's no other kind of medication, supplement, or special diet that's going to manage your thyroid cancer, treat your thyroid cancer, stop your thyroid cancer from getting worse, and certainly not make your thyroid cancer go away. So it really is, surgery is the best thing we have to offer people to treat thyroid cancer. More recently, we've learned that for a tumor that is under 4 centimeters in size with no suspicious features, a lobectomy, which means just taking out the half of your thyroid gland that has the cancer within it, is equal in treatment to what we did previously for everybody, which was a total thyroidectomy. The benefits to this are less chance of hypothyroidism, meaning that your remaining thyroid lobe may be able to provide you with all the thyroid hormone you need, and you can possibly avoid having to go on thyroid hormone supplementation. It also means that there's less surgical complications because half of your neck is being left alone. And that also comes along with using less radioactive iodine to have to ablate any further thyroid tissue. So patients who are still undergoing a total thyroidectomy and a lymph node dissection are patients who have either a large thyroid cancer, a very high-risk thyroid cancer for whatever reason. It could be that the thyroid cancer is invading the blood vessels. It could be the thyroid cancer looks like it's invading into the trachea or outside of the thyroid. Or it could be that you have large lymph nodes in your neck that we see on ultrasound that are also thyroid cancer.
So the more that we've learned about the reasons for thyroid cancer, the mechanisms, the more we can individualize treatment for it. So as Dr. Assadipour mentioned, the ultrasound characteristics and also the individual personal risk factors, the family history, any radiation exposure, age, and gender, and anything we know about the genetic mutations that are causing or driving that thyroid cancer, we can personalize the treatment, how much surgery is required based on all of that information.
Yeah.
So thank you so much for your attention. We'd be happy to answer any questions on Twitter using the hashtag UCLAMDChat. Okay, great. Looks like we have some questions. So I could take the first one. Does insurance cover genetic testing for thyroid cancer? It's a really interesting question. And in most cases, the answer is yes. So there's a couple scenarios where we do the genetic testing. One is if we're worried about a familial syndrome like the MEN that causes medullary thyroid cancer, and that is covered by insurance. And we really sort of get it in very specific cases, particularly if we know that that person has medullary thyroid cancer. And then there are other reasons where we do the genetic testing, and that is also almost always covered by insurance. Okay, next question is, does being gluten-free help to prevent thyroid cancer?
That's a great question. So there's no diet, including gluten-free or keto or vegan or vegetarian, that have been shown to decrease the risk of thyroid cancer. As we already discussed, when you're growing up or when your children are growing up, getting enough iodine in their diet is important. But as we said, salt, bread, even seafood is a great source of iodine. So if you're eating a balanced diet, that's probably all the iodine you need, and there's no other diet that's going to help change your thyroid health.
Okay, next question is, does stress cause thyroid cancer? I think that's an excellent question. I don't think at this point we have a real medical answer for that because it's a very difficult area to study and to quantify. So I don't have a great scientific answer that's based on evidence at this point. I do think that there's kind of a strong mind-body connection, and I think that stress can certainly play into a number of different conditions. But there is some evidence that in somebody who's hyperthyroid, stress can trigger an episode of hyperthyroidism where your thyroid may produce too much hormone. There's been no evidence directly that stress can cause thyroid cancer, but I think it's sort of an interesting area for future investigation. What are your thoughts?
Yeah, so what we do know is that chronically high stress levels correspond with high cortisol levels in our body. That's the stress hormone. And that having a high cortisol level long-term can kind of suppress your immune system and cause some other things. And since your body does help to fight abnormal cells, you could maybe say that by depressing your immune system, you may be being put at risk for, infections, and maybe there might be some minuscule cancer risk, but I don't think that we would have any evidence to really definitively know that. In general, minimizing stress is a great thing for all of us to try to do.
Yeah, I agree with that. Okay, next question is, are there symptoms for thyroid cancer that I should be looking for, such as pain in my neck? Thyroid cancer usually doesn't cause any pain, and that's really a common assumption that if there's a cancer that it should be painful. It almost is never painful. The only thing you would feel is usually a lump in the neck, or maybe some trouble swallowing if the lump were pushing on the esophagus. But really the main thing would be the imaging study that would show the tumor. Okay, next question. If I have somebody in my family diagnosed with thyroid cancer, do I need to get tested?
If you have just one relative with thyroid cancer, because thyroid cancer is so common, one relative alone would not necessarily be a reason to get screened yourself. But if you had multiple relatives with thyroid cancer, or you had a relative with medullary thyroid cancer, which is pretty rare and is more linked with an inherited genetic syndrome, then that could be a reason to get screened.
Yeah, I would agree with that. And I think, if there's a family member with thyroid cancer, then it's reasonable to ask your physician to do neck checks, which is a good part of the physical exam. We're wary about getting too many imaging studies, ultrasounds, and other kinds of scans, because there hasn't been evidence, even if somebody has, one family member with thyroid cancer, that getting those screening studies actually is preventative or improves your long-term outcomes. So we don't want to discover too many little things that we may have to act on that are not actually going to improve your long-term outcomes. Will I gain weight after my thyroid surgery?
Yeah, so that's a great question, and I think it's something a lot of people are concerned about. The bottom line is that if you have a thyroid lobectomy or a total thyroidectomy, your doctor is going to check your thyroid levels afterwards and give you thyroid hormone supplementation. And they're going to get you to that appropriate level for your body. And they can do blood tests to check and make sure that you're getting enough thyroid hormone. And if all of that is within the appropriate level, there's no evidence that patients after thyroid surgery gain weight.
Okay, and last question, is there a blood test to detect thyroid cancer? That'd be really nice. There is not at this point. Again, the only way is usually with an imaging study followed by a biopsy. There is a specific tumor marker for medullary thyroid cancer, but that's not very common. For the most common types of thyroid cancer, there's really no blood test we can do ahead of time that helps us to know whether a person has thyroid cancer. It's really ultimately the biopsy. So I think that's all the questions. Thank you so much again for your attention.